do the welcoming. And
yeah, once we're live on YouTube, it's preparing to stream live now. Once we're live on YouTube, we'll start.
you will let me know, Gechi, when it's time. Good evening. My name is Linda Gray. I am the Diversity Outreach Coordinator for ANWEP, the Texas COVID-19 Project. Welcome to our premier community conversations event about the COVID-19 vaccines, which have shown to be highly effective at preventing and mitigating the severe disease from COVID-19. ANWEP USA, through our project leaders across the state of Texas, has created a culturally sensitive, effective, safe space for African immigrants, Blacks, communities of color, African Americans to connect, network, and have their questions answered concerning the COVID-19 vaccines without the fear of the social stigma, which is a major deterrent for not taking the vaccines. This presentation will be a high-level, informative, and effective in educating all of us about the COVID-19 vaccines. Before I relinquish my mic, yes, just a few housekeeping webinar rules. Please mute your mic when you are not speaking. You are welcome to put your questions and comments in the chat area. And please be mindful of the allotted time for the presentation and discussion during our Q&A session. Now, I will pass the mic to Ogechi, the founder and the Chief Executive Director of ANWEP USA and the lead project director for the Texas State COVID-19 Project, to introduce our very special guest speaker this evening. Thank you. Ogechi?
Thank you so much, Miss Linda, for that very warm introduction. And welcome everyone to our August 2022 community conversation. As you all already know, ANWEP is working in partnership with the CDC and Texas Department of Health and Human Services to ensure greater access and knowledge of COVID-19 vaccines through education and outreach to populations disproportionately affected by COVID-19, with the goal of increasing the number of people fully vaccinated for COVID-19 in Texas. Without further ado, I would like to introduce to you Dr. Ndidiamaka Obadan, who is our presenter for today. The topic of discussion is COVID-19 vaccines in women, all right? Dr. Ndidiamaka Obadan is board certified in internal medicine, nephrology, and hypertension. She's a fellow of the American Society of Nephrology. She has a master's in international health policy and management from the Heller School of Social Public Health, Brandeis University, Waltham, Massachusetts. She graduated from the University of Benin in Nigeria where she and completed her residency with Harlem and Columbia University in New York City, nephrology fellowship from the Medical University of South Carolina. Dr. Ndidiamaka serves as an affiliate assistant professor with the Medical University of South Carolina and an adjunct professor with Morehouse School of Medicine. Dr. Obadan has special interests in gender and racial equity, as well as education. She is the Chief Executive Officer of Younger Self MD, which is a medical practice specializing in preventing and treating chronic medical conditions like hypertension, diabetes, and chronic kidney disease. Her practice is located in Kennesaw, Georgia, or Kennesaw, Georgia. Did I get that right?
Yes.
All right. So Dr. Obadan serves her patients/clients by providing primary care and nephrology services to her local community and beyond through in-person and telemedicine visits. She is also a health and wellness coach for her clients at risk of kidney disease and preventing the progression of established kidney-related illnesses. She's a wife and a mom of 3 beautiful children. Wow, what an intellectual powerhouse. Thank you so much. It's such a great honor to have you, Dr. Ndidi, at our community conversation today. And she has shared her social media handles, which we will display at the end of the presentation. That way you all can reach her easily if you're wanting to connect with her, if you have questions beyond this webinar today. Welcome, Dr. Ndidi.
Thank you so much, Ogechi. Thank you so much. I am so glad to be here today, and I'm very excited to give this talk. So today we're going to be talking about COVID-19, the safety of COVID-19 vaccine in women. And our goal, so just to disclose, I didn't receive funding for this talk. I am not promoting the vaccine because I have any affiliations with any of the pharmaceutical companies. I always like to put that there. And our goals for the talk is that at the end of this presentation, in the next 30 minutes, we should understand COVID better, understand the role of vaccination, and understand the effects of COVID and the vaccine on women, if that data is available. And we'll go through a brief outline. We'll talk about the history of vaccines, what we know about COVID-19, risk factors for severe COVID-19 disease, its effect on women, the COVID vaccines in women, and current CDC recommendations. So I want to start with a brief history of the bubonic plague. This is, for those who are not familiar with this pandemic, it occurred in the 1400s and killed about 50 million people. It was one of the worst pandemics in the history of time. It was caused by Yersinia pestis, which is a bacteria. But at that time, people didn't know what caused it, and they were using different practices, including bloodletting and using leeches and all sorts of practices at that time. This face mask is what the doctors who were treating people with the plague wore. And within it, they put in some scented herbs and different things which they felt were going to ward off the organism, the death. They called it the Black Death at that time. And we have come to realize that this is caused by this Yersinia pestis and is treated with antibiotics. And vaccines prevent people who are at high risk for exposure for the plague are vaccinated, and they prevent the risk of death from this disease. Another important history lesson is that of smallpox. Smallpox was first described in the year 1910, and it killed lots of people for almost 800 years, until about year 1000, when the early Chinese discovered that when they inoculate people who are healthy with the pustules from sick people, they were able to prevent death and severe disease in people who had the smallpox. And here in the United States, this disease was ravaging here up until the 1730s. And this is a note from Benjamin Franklin advising his citizens after his 4-year-old died because he failed to inoculate his son with the smallpox at that time. And so you can see him here urging everyone to go ahead and get inoculated so that they don't make the same mistake that he did at that time. And just by way of reviewing the history, the first vaccine of smallpox was found by Dr. Edward Jenner in 1796. He developed the first vaccine. And by 1806, President Thomas Jefferson became an advocate for vaccination. It went into law in 1855. And by 1980, in May of 1980, after massive vaccine efforts, WHO, the World Health Organization, declared that smallpox was eradicated. And so vaccines work. Vaccines save lives. So let's talk about COVID-19 virus. It is caused by the SARS-CoV-2 virus, was discovered in December 2019 in Wuhan, China. It's very contagious and it led to a pandemic. The death toll so far, when I checked the CDC, has been 6.4 million worldwide. And here in the United States, it's approximately 1 million. I'm a personal witness to this because when COVID first came out in March of 2020, I was working in the hospital, and I can tell you that within 6 months, the number of deaths that I saw in the hospital that I was working in was more than I had seen in my entire 15 years of practicing medicine. So it is a serious disease. The symptoms can range from being asymptomatic to being mild and to being critical, as you can see, as all the deaths it's been causing. You have non-specific systemic symptoms of fever, chills, muscle aches, loss of taste and smell. You could also have respiratory symptoms, cough, congestion, runny nose, and lower respiratory symptoms, shortness of breath, difficulty breathing, and GI symptoms, nausea, vomiting, diarrhea. So yeah, it can present in different ways. How does it spread? It's through direct person-to-person contact, especially when they are at close range, within 6 feet or 2 meters, via respiratory droplets. The virus is released when a person sneezes, coughs, or talks, or through direct contact with the mucous membranes. So when is it the highest risk for transmitting this disease? Within the first 7 to 10 days of infection. And the risk of transmission varies by the type and duration of exposure. So people who live in the same household of people who are infected are at higher risk. If you have traveled to areas that have high, we'll see going forward, travel is also a risk factor for high transmission. And individual factors like the amount of virus present within your respiratory secretions when you cough or sneeze. What are the risk factors for severe COVID? We've talked about how you can have really mild disease and you can have really severe disease. So what causes people to become predisposed to severe disease? If you have any of these chronic medical conditions, including chronic kidney disease, diabetes, high blood pressure, mental health conditions, obesity, chronic lung conditions, chronic liver conditions, or immunosuppressed states such as cancer or transplant, if you've received a transplanted organ. What are other risk factors? If you are older than 25 years old, if you are living or working in a community with high number of COVID cases, or if you're living or working in a community with low levels of COVID vaccination, living in overcrowded area, or being part of some racial and ethnic minority groups. These all increase your risk for severe COVID infection. What about COVID in women? So I have to say that the data is not segregated. Many of the studies have reported mostly in the general population. There are very few studies, as we'll see later on, who really segregated the data by men or women. So what they found so far is that the COVID cases are equal in both men and women. Men are have three times the odds of an ICU admission and 40% higher odds of dying from the disease than women. This is what the studies have shown. And the reason for this is because of our adaptive and innate immune responses and some social, cultural, gender constructs which influence the outcome. For example, women tend to work in higher job exposures. You know, they are nurses, they're in the healthcare field, and so they're exposed. And they also have better engagement with using the health services for prevention, detection, and treatment. So, you know, women will tend to test sooner, they will tend to report symptoms earlier, and they will tend to, you know, follow up with the physicians versus men. Also, men tend to have higher risk factors for severe disease. For example, they tend to smoke. There's a higher incidence of cigarette smoking in men than in women. And men have a higher number of comorbid conditions that increase their risk. So this table is just demonstrating, on this table, I want us to notice the graph that shows the weekly number of cases. This is the incident cases on the y-axis, and on the x-axis is the case alias date by end of the week. And the female is in pink, male are in yellow or orange. I don't know what this color, but what is important to note in this graph is that the two lines are following each other all the way. Even so, the case exposures are pretty much the same as we talked about in the text. And in the next graph, we look at the same trends, but now you can see that the graphs have flipped. You can see that there's a gap here because we're talking about the death rate. So the incident deaths per 100,000 population in men is significantly higher than in women. And even though this has reduced over time, you can see that by the amplitude of the graphs, it has reduced as of July 2022, but men are still dying more than women in this graph. And this is the latest CDC guideline data. So here, this is a graph that stratifies the data by age. And when they looked at the pink solid line is for people who are aged 75 plus, they have the highest death rate. And the next highest, the dotted line, between the 65 and 74. So once you're above 65, you're going to have a higher death rate compared with the younger population. And, you know, one can explain this because the older you get, that's when the comorbidities start to set in. And, you know, those are the things that are linked with severe disease. So that this data is good for us to acknowledge that. So since we're talking about women, what about in pregnancy? What do we know about COVID disease in pregnancy? Well, pregnant women or women who have just given birth are extremely likely to get sick from COVID-19. They have an increased risk for complications. The study that compared pregnant women versus non-pregnant women who were aged 15 to 44 found 5 times higher risk of ICU admission, 76% increased risk of invasive ventilation or extracorporeal membrane oxygenation, ECMO, and 1.3 times higher the risk of death in those pregnant women versus non-pregnant. So that's important. When you're pregnant, it increases your risk for death. And during the Delta period, when the Delta variant came out, there was also Delta variant was associated with significantly increased severe disease and death as well in pregnant women. So what are the current CDC recommendations for testing? If you have been exposed to anyone who has COVID, wear a mask and start taking precautions. You need to continue precautions for 10 full days. You wear the mask and watch out for symptoms. If you develop symptoms, isolate, get tested, and stay at home until you know the results of your test. Test, even if you don't have any symptoms, test on day 6. Even if you don't have symptoms, get tested on day 6 just to make sure. If you have already developed COVID in the past 90 days, the recommendations are different as far as when to test or not. Because if you are within 30 days or less without symptoms, you don't need to retest. They assume that you still have the antibody from the first infection. But if you are within 30 days and less with symptoms, you need to go ahead and get tested. If you are within 31 days from your first disease exposure, 31 to 90 days with or without symptoms, go ahead and get tested. If you have a negative COVID test, just continue taking precautions until day 10. That is the latest CDC recommendations. And then if you test positive, what do? Go ahead and isolate immediately, whether or not you have symptoms. And if you've had symptoms, stay at home for at least 5 days and isolate until you're symptom-free. And then continue wearing a mask to complete 10 days. So let's go ahead and talk about the COVID vaccines. The COVID vaccines are safe, they are effective, and they are free. They are free. They help prevent you from becoming seriously ill or dying from COVID-19. The vaccines teach your immune system to identify and fight the COVID-19 virus. There have been 4 COVID vaccines approved in the United States: the Pfizer and Moderna vaccines, which are mRNA vaccines, the Novavax, which is a protein subunit vaccine, and the Johnson & Johnson, which is a viral vector vaccine. I put this slide here just to remind us a little bit about the mechanisms of the mRNA vaccine. We don't have to go into all the details, but just to note that they are just different mechanisms that do not, I'll tell you all the things they don't do in the next slide. So these vaccines do not have preservatives. They do not have antibiotics like sulfonamide or any other antibiotics. They don't have any therapeutic agents like ivermectin or any other medications. They don't have tissue cells like aborted fetal cells and any material from any animals. It's very important to note all these things because these are the things that sometimes we hear and we read about in the media, and a lot of misinformation going on around about these vaccines. They don't have food particles, proteins, or egg products. COVID vaccines are not manufactured in facilities that produce food products. They don't have metals like iron, nickel, and all these other earth alloys. This was very interesting to me as I was reading the CDC website. They don't have carbon nanotubes or nanostructures or nanowires or semiconductors. They don't have latex. You know, there have been so many controversial things that have been said. These vaccines are relatively safe. And what does the CDC recommend as far as getting vaccinated? Well, the primary series consists of 2 doses of the vaccine, and then they recommend getting boosters at specified intervals. If you are immunocompromised, either with cancer or due to some other, transplant, or if you're on with autoimmune conditions that require you to take immunosuppressive agents, if you're immunocompromised for whatever reason, they recommend 3 doses as your primary series, and then your booster doses at specified intervals. So in women, as I mentioned earlier, this study was one of the few that was available that tried to answer this question about if there were gender disparities or what they were. And they looked at 323 different studies, observational studies, randomized controlled studies, trying to answer this question. They found 41 relevant studies, and of the 41, only 10 of them evaluated the vaccine efficacy, and only 3 of them included sex segregated data. That means they separated men and women. And only 2 randomized controlled trials reported on the efficacy. And they found that there was no difference. There was no significant difference in the primary efficacy of the vaccines between men and women. So in both men and women, the vaccines work the same. So I put this slide to remind me to tell us that this is limited evidence because it's just from 2 randomized controlled trials. And so maybe the studies might change if more trials find something different later on. They definitely found a higher risk of adverse events in women versus men. And let's evaluate this on this forest plot from the article. So if you look, this is a forest plot that demonstrates, can you see my screen? Can everybody see my screen? Because for me, I have my screen showing us, and I don't know what you can see, but so this is the figure shows a forest plot of the risk of adverse events following COVID-19 immunization reported in women versus men. And the adverse reaction is listed here on the left. This line here at 1 is the line of neutrality. Anything to the left is higher in men, and to the right is higher in women. So we can see that when they look at pain, redness, swelling, headache, fever, the things that women would definitely notice and complain about, they found that women were significantly had more. They had more side effects. So this is the N, the number of people they evaluated, and the N, which is the number of people with the adverse events. And I mean, the women here, and here you have the men listed. And so on this graph, you can see that women had more local pain, redness, swelling, headache, fever, and nausea, vomiting, diarrhea. But what men had increased arterial events. So that's the only significant thing that was revealed as the adverse events in men. Of note is the risk of thromboembolism, blood clots, and that's significantly more in women. I was thinking multiple factors. Women tend to be on hormones and oral contraceptive pills and so many other things that increase our risk for that, in addition to the fact that the COVID vaccine itself, the COVID virus itself increases your risk for the blood clots. So multiple factors. But I just want us to note that the numbers, even though it's significantly higher when they compared men versus women, you got to look at the absolute numbers, because 200,000 people received this vaccine and only 54 of these women came down with the blood clots. And in men, it was about 60,000 people who received the vaccine, and only 5 of them came down with blood clots. And so there's a significant difference between 54 and 5, and that's why we see the forest plot being this way. When we compare anaphylactic and non-anaphylactic reactions, just these numbers were striking to me, because if you look here for the Moderna, about 2.5 million women received the Moderna vaccine, and 1.1 or 1.2 women received the Pfizer vaccine. And of those millions, only 75 versus 39 of them had the side effect of non-anaphylactic reaction. I would say that they probably, this is a safe vaccine. These are safe, relatively safe vaccines. There are a few side effects. I mean, anaphylaxis is the dangerous one, but out of 2.5 million people, only 10 women got it. And when 1.5 men got the vaccine, none of them got the anaphylactic reaction. So what can I say? You have to, it is relatively safe. There are still some side effects which have to be reported, but the vaccines are definitely safer than losing 1.1 million lives in such a short period of time, or 6.4 million globally. These are negligible numbers, as we can see here. So that was a study looking in trying to answer the question of segregated data, looking at men versus women. In the general population, it is established unvaccinated, when you compare unvaccinated versus vaccinated, the unvaccinated had a greater risk of testing positive for COVID, and they had a greater risk of dying from COVID. And when they looked at primary series, and if you got additional, your full dose, your full boosters, you had a lower risk than if you didn't, than if you got just the primary and one booster. So the more boosters you get, the safer you are. We'll see that in the next slide. This is a nice graph that shows us the rate of deaths by vaccination status. And the black line demonstrates those who were unvaccinated. Look at on this y-axis here, we have the incident number of deaths per 100,000 population. The blue line shows us those who were vaccinated with at least a primary series. And we've defined that primary series means at least 2 doses. You can see how high this unvaccinated group is, and the relatively flat line that we see in the blue after they've been vaccinated with at least primary series. So unvaccinated people age 5 years or older have 2.1 times the risk of testing positive for COVID-19 and 5 times the risk of dying from COVID-19. This is the CDC data as recent as June of 2022. So it's definitely helpful to get vaccinated. This is another graph that shows the rate of death by vaccine after getting 2 or more booster doses in people who are aged 50 and above. Again, the black line is the unvaccinated, way up there. And the primary, those who have received the primary series plus 2 booster doses in purple, it's a flat line, not many deaths when you compare with the people who have been unvaccinated. So I feel like we've been saying this the same, over and over again. The vaccines save lives, and if you're not vaccinated, you are increasing your risk of dying. People who were age 50 years and older in the unvaccinated had a 14 times increased risk of dying compared with people who did not get vaccinated, 14 times the increased risk of dying. So what are you waiting for if you haven't been vaccinated? And I talked about this a little bit, but I wanted to just emphasize that even in nursing homes, the COVID vaccines were effective in preventing the infections among nursing home residents. Oh, why is it going back? Okay, so moving on, when you look at the evidence of safety, now this is when you combine all the data globally. Millions of people within the United States have received this vaccine, and there is evidence that billions of people worldwide have received this vaccine, and it is safe and effective for them, for everybody. What about in pregnancy? What does the CDC recommend? Get vaccinated at any point and get your booster doses when eligible. It will protect you and your baby from severe disease. It's important to get vaccinated. What about if you're breastfeeding or if you are planning to get pregnant? Same recommendation, get vaccinated and stay up to date with your booster doses. And so these are our summary points. COVID-19 is a deadly disease. It has killed a lot of people. COVID vaccine prevents disease and saves lives. The vaccines are safe and free. Women should definitely get vaccinated. If you're planning to get pregnant, if you're already pregnant, if you've just given birth, if you are breastfeeding, the vaccines are safe. Go ahead and get the vaccine. Imagine if we were living in a world without the COVID-19. I remember how it was before, all these issues of traveling and having to take the test and all that. Remember, imagine if we could get that world back. We can beat the virus just as we got rid of smallpox. So let's do this together. Let's do this. Let's get vaccinated. Thank you so much for listening. And I'm happy to answer any questions. Feel free to email me at admin@youngerselfmd.com. And you can visit us on our website at www.youngerselfmd.com. Thank you.
Thank you for that great presentation. And now at this time, if there are any questions that individuals want to ask, please unmute your mic and feel free to ask your question. If not, feel free to actually type in your question at this time. And I'm looking in the chat and I see no questions. But evidently it is a great presentation that really answered my questions that I had. So if anyone else.
All right, I believe I've brought in everybody into the conversation. I have Dr. Anthony Wobun. I have Dr. Rachel Azinge, Ms. Isioma Medowa, and then Dr. Oyin Jinadu. So does anybody, I know we have some medical practitioners here. Does anybody have any questions for Ndidi, or does anybody have something to add to the conversation about women and COVID-19 vaccines?
Let me unmute, I'm sorry. There is a question, Ogechi, in the chat.
Okay.
And I believe they are unmute. Please unmute yourself.
Hi, my name is Isioma Medowa. I just wanted to say, no questions. That was a great, a beautiful presentation, Dr. Ndidi. That was awesome. I learned so much up to the 14th. What year was that? Oh my God, that was amazing. Thank you so much. Thank you.
Thank you. I'm glad you found it helpful.
It looks like Mr. Mohammed Abdullah has a question. Hi. Do you have a question, comment, feedback? You're muted. I think you're muted. Let's see.
Okay. No, it was very wonderful. I enjoy much. I initially have a question that there is difference between women and men with the, but at the end I understand because the sign were different from one to another. So I learned that. Thanks.
Yes. This is definitely a great presentation, Dr. Ndidiamaka. I learned a lot too, a lot of the things that I didn't know, particularly how COVID-19 impacts men versus women. It's very important to note that, you know, women may tend to react more or have some side effects more than men, you know, you know, is not to create some sort of discommunication or disinformation or misinformation, because I don't want to make people afraid of getting the vaccines now, but these are facts that if you get the vaccines, you may have some reactions, but they go away. Right?
Yeah.
So
Correct.
yeah, you can add to that, Ndidi.
No, yes. I mean, I agree with you. Women are more likely to complain. If you give them a shot on their arm, they're more likely to say it hurts, it's swollen, it's painful, it's tender. They are, you know, because we're women, you know. And men are going to say, oh, it didn't hurt. They're not going to tell you that they're in pain, even if, you know. And yeah, so definitely those are some of the things to consider about the side effect. And even when we looked at severe side effects, we saw how small the numbers were. You have to 2.5 million people the vaccine to get 10 you know, anaphylactic reaction. I mean, they probably would have gotten the anaphylactic reaction even without getting the vaccine. I mean, it's just that small, you know what I mean? So it's definitely it's definitely, you know, you better take that risk because the virus is going to kill you much faster.
That's right. And it's interesting again to note that when it comes to like blood clots, women are predisposed to getting that more than men because we do things that make us more vulnerable in that regard, like birth control pills, and things of that nature. Right. So that was, you know, that was an interesting thing to note as well, this presentation. So, Dr. Oyin, do you have anything to add? Dr. Azinge, you're quiet. And then Dr. Anthony Mobum. These are all medical heavyweights. So I want you all to weigh in on his Dr. Ndidiamaka's presentation.
Thank you so much, Ms. Oge. Dr. Ndidiamaka, thank you so much for a very concise, extremely detailed presentation. I love the fact that you went through history because it's important for us to understand that COVID-19 did not just appear out of thin air. And it's not brand new to the ecosystem of microorganisms that we've had to deal with in years past. And, you know, your presentation highlighted a lot of things that women have to be very mindful of. And I think this would allow us to better serve our communities by being able to better educate, you know, our constituents as far as how the difference between a man's reaction to COVID-19 and a woman's response to the same virus impacts, you know, mortality rate and things like that. Because I feel like oftentimes we take it for granted and we don't know that there's several factors that play into whether or not you survive, you know, the infection or not. And also encouraging more women to, because, you know, when I feel like if we encourage more women to understand the importance of taking the vaccine, then they're better able to even encourage, you know, the family members, you know, the men and the children to do so. Yeah. So that's one thing. So thank you so much for the wonderful presentation.
Thank you. You're on mute. Are you talking?
I'm sorry. I said, Dr. Oyin, thank you, Dr. Oyin, for that input. Dr. Nwobu, do you have anything to add? I think we have a few minutes before we wrap up. We normally want to keep our community conversations under an hour. All right, I don't hear from Dr. Nwobu. Mr. Mohammed, would you mind sharing where you're from? What country? And can we follow up with you to target, your...
Sure, thank you. I'm from Comoros Islands. Comoros Islands in East Africa.
Oh, wow.
For the people that are not familiar with it, it's a very small, teeny country. For the African that are lover with the soccer game, the CAF, Comoros was the most popular team for the last CAF that we beat Ghana and put Cameroon in trouble.
Wow, that's interesting. So do you have a huge community in Texas here?
I think maybe, but I didn't meet one yet. I didn't meet one yet, yes. But so, Comoros, we have less than 1 million people altogether. So even if you bring all the Comoros and put them in Dallas, you will not recognize them because it's a very small, teeny country.
I see.
But certainly there are some people that I didn't meet them yet.
All right. So you live here in Dallas County?
Yes, in Richardson. In Richardson, yes.
Okay. Yes, I would love to connect with you because we have these outreach events on a monthly basis. And we are targeting mostly African immigrants living in the state of Texas.
I have already my 3 shots for the COVID. So.
Oh, that's good. Yes, that's very good. Well, welcome. It's good to have you.
Thank you.
Yes.
Thanks.
All right, Linda, do you want to take it away? I first of all want to thank Dr. Ndidi, for accepting our invitation and putting in her time and efforts in developing this presentation, which is wonderful. I am so blown away by, see, when I say Nigerian women are intellectual powerhouses, I really, really mean that. We don't kid around when it comes to serving our communities. We're very, and it's for all women. I know that Linda is not Nigerian, but she's very passionate too. Matter of fact, she trained me. She was one of my mentors, from small business administration. And after that training, I'm like, I'm going to stick to this woman like a glue, how will I put it? Like a bee sticks to honey, and I follow her everywhere, and I had to drag her into this project. So it's very, very heartwarming to get to meet and connect with women who are like-minded. Women who are passionate about paying it forward, about giving back to our communities. This project is very much needed. A lot of things impact our health, and these conversations are very important so that we can keep ourselves, families, and our communities healthy and safe. So thank you so much, Dr. Ndidi. And like you said, we didn't pay you for this. I know, women like you, we can't even afford your time.
No, I always have to put that as a disclosure, just so that people, usually if you are funded by an organization and you come and promote what they are finding, then how credible are you at that point when they're paying you to say that? And so usually I just disclose at the beginning, but I also want to thank you for inviting me to join. It was a very nice opportunity. I love to serve my community as much as I can, and I'll be happy to come back as well. It's definitely a service opportunity, and I'm glad that I got it.
And how about we adopt you as one of our honorary members of ANWEP?
Okay,
I'm
well,
going
thank
to
you.
be, yes, I'm going to be extending that invitation. Maybe we'll get you just a 1-year free membership to our organization.
Oh, wow,
And if
that's
you like us,
amazing.
yes, if you
Yes.
like us, then you can stay.
Oh, I love you already. I love
Oh,
you
thank
guys.
you.
And
Thank
I'm
you
going
so
to be
much,
in
Didi.
Dallas. I'm going to be in Dallas for a conference very soon. So
Oh, wow.
I'll reach out to you when I get there.
Yes, please. I would love to. I would love to connect with you. Definitely. Definitely. And we will want to honor you during one of our, annual conferences or annual conventions. So thank you. I appreciate this work very, very much. Thank you. Miss Linda, do you want to take it away?
I'm really full. I can really talk us out of here, okay? It's getting late in the evening, but we want to thank everyone for attending this event. It is so important for us as community leaders, community volunteers, and actually our frontline professionals in the medical field that can share their wisdom and their knowledge to our people in our community. Although I'm not from Nigeria, but I've got a little Nigerian blood.
Yes.
Let's put it like that.
Yes, yes,
And then,
Linda, I agree. I agree.
and then not only that, my husband worked in Nigeria for almost 16 years with the
Wow.
oil company, ExxonMobil. And so he's very loving to the people of the mother country. And so with that being said, we just want to really help our people in our community. And look, all people are welcome to our community conversations because it's so important that everyone have knowledge. And we want to thank you as our special speaker, Dr. Woman, in conversations.
Thank
And then,
you.
so without further ado, I want to again thank everyone for attending. We will have other conversations, community conversations, and this has been a great opportunity. I want to thank Ogechi for giving me the opportunity to be able to participate and serve in my capacity as a diversity outreach coordinator for this prestigious Texas COVID-19 project. So thank you all.
Thank you, Linda. It's a pleasure. It's a pleasure to work with you. Thank you. Good night, everyone.
Good
Enjoy
night.
the rest of your evening with your families, and we will reconvene next month on yet another community conversation. Thank you. Okay, bye-bye.